You know, since we started the day with the older demographic, older people shouldn't eat healthy food. Did you know that? They need all the preservatives they can get. Not even a giggle. I'm trying to give you some jokes, wake you up in the morning, day two. See, that's just joking. They should definitely eat healthy food, and there's no doubt that food has a lot to do with our health. So, fantastic panel. So, since we don't have time for questions, we're going to take it to the next panelist. Actually, it's not panelists, it's our keynote. Our top silver sponsor, Burjeel Hospital, is going to come up next and address the greater need for corporate responsibility and accountability, especially initiatives in healthcare, right? And environmental protection has never been more pressing. Keep this in mind. Our next speaker is going to discuss practical methods of incorporating ESGs and SDGs into healthcare delivery models and the impact on patient outcomes. So we're going to take a look at a video for 2 seconds before I invite him up to the stage.
Success in life is a journey, not a destination. Very few hospitals have character and beauty and ambience. That turns classical hospitals to what we call well-being center. You walk in and you feel over there, you feel better. Team that can work with you to make you well happy. In Burjeel Hospital, we have over 54 nationalities and more than 60 or 70 languages spoken in the hospital. All employees have this history of being partners. So since I started, since day one, I was part of the team. We know that really freedom of class, freedom of language, scholarship, is always forcing that futuristic. And it's not only dream, the dream and then the dreams come true.
But in order to go this way, they have to have the backup from the people who work on the ground, which were us in the health sector. We became a hub for good medical care, and now we reduce the number of our patients from UAE or the region who go to Europe, North America, and Asia. They became coming here. In my position as chief executive, I work very closely with each and every department of the hospital. And I have colleagues who become friends, like younger generation, aspiration, future colleagues. And that by itself, always I tell them that success is a journey, it's not a destination. This vision of Burjeel Hospital, which is mainly based on the founder's dream, that provision of the best healthcare possible to all, equally and with the same excellence that can be provided. In Burjeel, we have so many units. In Burjeel Holdings, almost like 61 around the area. One of our mottos is provision of best quality of care to all, regardless of the costs and the insurance cover. This year, for example, 2023-2024, is a year of quality and productivity. We sustain the quality. When we talk about sustainability in our organization, it's sustainable development. That's the magic we have.
Burjeel Hospital, Abu Dhabi. So amazing. As I invite up to the stage Dr. Omer, who's an accomplished consultant surgeon, internationally renowned speaker, and lecturer in medical management, motivation, ESG, and surgery. Here he is. Give him a round of applause. Thank you.
Thank you very much. Good morning. By the way, the video took me by surprise. I never thought it's going to be here. Okay. Good morning, everyone. I hope that you're enjoying your time in UAE. For those who live here and those who are visiting here, and as we say, UAE in general always become part of your life once you step on its soil. I was given the task to talk about environmental, social, and corporate governance, sustainable development goals in healthcare. It sounds just a small thing, title that everybody knows about. But the minute you go into depth, you find out that everybody understands it a different way. And this is a magic. Because the whole issue, if we place it in a frame, then we reach the same end destination. But it's left open because it's continuous, developing, and changing every single day. But there is general points that I would love to talk about here and mention to give a bit of a holistic idea. And I believe that will keep the door open for each and every one to think about it and have his own input from a philosophical, scientific, and humanitarian point of view. So there is a big question that usually people ask. What's the relationship between ESG and SDG? Okay, ESG is environmental, social, and governance, and SDG, which is the United Nations Sustainable Development Goals. Where do they come together? Are they the same? Are they different? Is it different nomenclature? Where did they come from? I mean, till recently, okay, last decade, people would talk about corporate social responsibility. Suddenly, that started to disintegrate, and ESG came into its place. Is it something different? No. It's a natural development of the corporate social responsibility. People start to look into it. And for some reason, they change it, and you'll get to understand the reason here. So, well, I mean, like, United Nations Sustainable Development Goals, and as I mentioned in the video, is sustainable development, not sustainable full stop. Because if you talk about sustainable and stop there, it means it's stagnation. But we need to develop. Sustainable development, the development bit is very important. It's set out by the United Nations where ESG became a rating system used by companies to measure their environmental, social, and governance credentials, which matters to their stakeholders, particularly the investors. And when we talk about stakeholders, it's not shareholders only. It is the society, it is the regulatory bodies, the government, the shareholders, people who would love to invest in the same area, and general investors. And we're going to talk about that in a minute. We're going to just mainly focus on ESG and SDGs in healthcare, so we'll not lose track. Okay. So, in the past, the ESG generally, right? Okay, corporates used to think about bottom line, and I mean bottom line is higher. Top line is mainly revenue, how much revenue from they generated, and bottom line is profit, whether EBITDA or just profitability in general. That's what counts for, and people measure your success by how high your revenue, how high your bottom line is, and they give a judgment that is a growing industry or company. I'm not saying progressing or successful, because there's a big difference between growth, success, and things. So is it growing or not? And is it worth investing in it or not? Today, there is triple bottom line, okay, which is mainly based on planet, people, and profit. Profit still plays a big role there. But planet became important, and people became important because they added the ethical element to the growth, to change it into progression and development. So ESG rating, now everybody used to think that ESG is just an ethical commitment. No, is quantitative now, and there is a rating for each and every company. It's the exposure of long-term environmental, social, and governance risks and its implication. This is mainly very important for investors nowadays. In the developed world, people who invest mainly, or organizations that invest, the biggest investors are banks and pension funds. And now, because of the change of the demography of the people who run this show, they became younger and younger and younger. Consider myself the baseline, okay? Because, so they become younger and younger and younger, and these millennials have different opinions. They are not always profit-driven. They went back to principles of humanity and and tied themselves to principles I believe in. So they're happy to reduce what we call a profit for some ethical things. And if your footprints are, carbon footprints are high, youngsters might say, no, we don't want to invest this. I would like to invest in clean energy, because in the long term, it's going to be good for everybody. So that ethical dilemma came a little bit more stronger, and this is why your ESG rating became very important, especially in the health sector, because the health sector is one of the sectors that attracts the least of investment, because people believe that it can be risky, and it's pushed also by ethical dilemmas. COVID hit the world. You have a health institute. Are you going to stop because you're not making money? You can't. You have to carry on. So it's very volatile to market factors. So it came now to this area that's became very important, ethical. It is important for the environment, social, and governance structure that's going to come all together, and we're going to talk about them in details. So these are the three diagrams. Okay, for environmental, we talk about gas emissions, carbon dioxide, methane, extra. Biodiversity, mainly people should not stick to one product that they use. I mean, not plastic, 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 plastic all the time. You have to diverse from your things, so you will not eliminate a lot of the resources on the planet, as well as not to cause more damage by one way, and manage it accordingly. Waste and water management. In a planet that there is a large population of these people deprived from fresh water and clean water, we're still, on the other hand, having waste contaminating things and water being contaminated even at the level of below the surface. Use of natural resources. Why? Because it's biodegradable. It can be reused again, recycled. Okay, remember that this planet is too big, but still limited. And we are thinking about going to Mars, but still going to use these planet resources to go to Mars. A very strange thing. So we're not going to, our exploration to other planets is to expose ourselves to new areas and get more resources. But if we cannot look after our own planet resources, we're not going to succeed. The social bit, there's the diversity and inclusion, consumer protection, community support, nutrition, and health, which is put in a circle there because it becomes a major issue in health maintenance and well-being. There's governance, which is a cornerstone in everything, because remember, this is also a measurement that goes into your financial statement and where you stand as a successful business financially and economically, which is mainly business ethics. That's to prove that you have the proper board decrees and laws and policies that goes with that one. And competition, where do you stand from your competitors, and how you're going to have a symbiotic relationship in development, not like hitting each other to go lower, but to succeed and go higher. Accounting and transparency, this is very important, especially in countries where taxation plays a big role. They want to make sure that it is a situation. And this is one of the main things for the government as stakeholders in any organization. And it's frowned upon because a lot of Ivy League management schools give examples of companies in the States that relocated in Belgium or offshore, mainly to reduce the taxation. And this is reduced the rating in the governance side. And they became not the favorable to win United States bids for any projects that's funded by the government. Management structure, okay, employee relationship, which is very important. We'll come back to that one. So this ESG, I mean, like you can see that I put it environmental in green, governance in blue, and social in orange. All these sectors do integrate together. They do affect each other. I'm going to be talking with a focus on the health system. And the health system is not hospitals only. Pharmaceutical industries, home care, community centers, community health activity, screening programs, health education, all this comes into the health care system. We always stick to hospitals in our minds, and everything other than that seems to be like a new concept to healthcare. But healthcare is a very big umbrella. So if you look at environmental, okay, the climate change, we have to look into that. This is something very important. And the Air Summit talks about it, the G20, the G4, 5, every G in the world talk about it, okay? And how the health sector can play a role in that is mainly important because if you look at as I mentioned, per square inch of health services given, we are the highest polluting industry in the world. If you look at pharmaceuticals, the amount of water waste that's contaminated, that goes back into the system is amazing. If you look at the amount of plastic we use per inch, okay, surface area, or per person, it's massive. All these disposable syringes, disposable instruments being cycled again, and I believe that my colleague, who is a plastic recyclable chap, can talk about it more. The amount of contamination from burning it, incinerating it as well, is unbelievable if you look at it. That integrates also on pollution and waste. Our waste is not only just a normal waste in healthcare systems. It's got very toxic chemicals in it. From standard chemicals that produce with what we use every day to chemotherapy and including radiation and things can be really harmful for nature, humans, and whoever on the planet. Resources and land use. This is another issue because sometimes there is a land filling projects to fill up things, and we are not depriving green buildings to be hospitals and so on, radiations. Ecological footprint, we know all about that, and biodiversity. We focus on certain things till we run out of it and then change it. Even antibiotics, we don't produce a new antibiotic till we run out of this antibiotic use completely. For different reasons. People make us believe that mainly because we don't develop resistance, but it's mainly also have a financial element on it. The social health and safety is a very important part, especially in hospitals, where employees and visitors as well, and in the industry, pharmacy industry, they have massive health and safety risks. From things that can be seen to things that are not seen. And it's always, if you look at every day, you might have a stadium filled up once a week for a football game. And you can have some Christmas shopping area for 7 days of a week of the end of December. But hospitals are every day filled up, people going in, going out, 24/7. So that's very, very important as well. Product consumer responsibility and community impact. Health systems have one of the strongest impact on the community. Humans usually are aware of certain things, nutrition, food, being healthy to go get food, and being able to afford it. So it's financial, physical ability, and nutrition and feeling well. And here in the health system, okay, if we don't support the community in that way, in different ways. One, a lot of people have been talking about health education. This should be a responsibility of the health sector because they know better and they can deliver it and they're trusted by the public. If a renowned health organization comes and talk about something, people believe it. Like what happened in COVID. WHO, we all trust the WHO. But when they started, they had things that quite now if looked at will be frowned upon. I mean, what do you mean that don't use masks? That was not the priority of WHO. Now everybody knew that if you did not use masks, Corona would have been worse. So the responsibility lies within the health sector for education. Also, this is for the public, for the community, and also for its own people. When we talk about the last one, which is labor standards and human rights, okay, this combined with that one is, as Dr. Mustafa always mentioned, healthy employees means a healthy company and healthy society. You have to look after the providers themselves in the health system. It's a very stressful situation, okay? I'm very glad to see that Dr. Fatma there with the baby, right? Which is something, I think that he's the youngest ever person to attend a conference like this. So I wish to take a photo later on. Seeing this generation, the mother and maybe the grandfather here, right? It is something that the health impact is very important. We're here sitting for a health meeting, and we look at this. Forget about having education and going outside to educate people, which is very good. For our health sector, we're good at educating each other, but very, very, very poor in educating others. And those who go out for educating others, most of the time is based on their personal opinions or marketing activities. This is a little bit still area to envisage. Health workers, healthy workers, healthy atmosphere, successful business. The governance is a big issue here, okay, because this governance is not only for healthcare, it's corporate governance, okay, covering everything from business ethics, very difficult to be 100%, but it's there. Tax transparency for tax countries, risk management, okay, they know the market risks and what is internal risk, what the seeds for success and the seeds for destruction. Risk management, they have to make sure that they manage the risk for the company. It's not good enough to think about, oh, if we make it, if we don't make it, we declare bankruptcy, we're okay. You have workers, you have people, you have impact on the society, that's beyond belief. So you have to take responsibility of this. Anti-corruption, all right, and bribery, this is something being practiced and growing up, needed to be stopped. It became part of the governance structure. And leadership, which is very important, to choose your leaders, your governance, that will not follow just what the stakeholders want, because stakeholders want profit most of the time. They have to set the pace and dictate how it's supposed to be. The importance of ESG in healthcare, okay, is providers, payers, pharmaceutical, and life science organizations have history embraced the social pillars of environment, social, and governance. By being in health sector, we are the most sensitive industry for all this, the environmental, social, and governance, because we see its impact on people firsthand. So this is why we have to set an example and be ahead of everybody else in the ESG dictations. And we have to work into creating medications, vaccines, devices, teaching, set an example of how we manage our diversity, our employees, our outcomes. So why people should be interested in ESG? As I said, it's always almost financial, okay? So ESG links to cash flow in 5 important ways. Facilitating top-line growth, which we understand. Reducing costs, because if it's good, it can be reducing costs at the end of it. Minimizing regulatory and legal intervention, because they know that you are ethically, you are committed to this, so they leave you alone and come to you as an example to support them rather than check on you. Increase employees' productivity. People, when you give them attention, they give you attention back. If you like them, they like you back. If you love them, they love you back. If you appreciate them, they appreciate you back. And everybody works. Little appreciation takes you miles. They work hard. And not only for the organization, but for the society, for everything around it. And it optimizes investment and capital expenditure, because it has to be studied all the time. It's not a matter of just like, let's get it. Okay, so good ESG strategy looks, establishing ESG strategy implementation plan. This everyone have to have one now, not tomorrow. It's supposed to be yesterday. So there must be an ESG implementation plan. It doesn't matter, is it robust, good or bad, but there. Create long-term objectives to monitor delivery of all the elements of ESG. Identify current and future risks in your business, wherever you work in healthcare. Look at it, put it down priorities, and nowadays you should always have somebody who would be in charge of ESG and sustainable development goals in any organization. It doesn't need to have a background, but somebody's going to read and look at it and work on it. So measuring ESG performance, I said like now is a measurement, and there's a ranking for it, okay, and how we're going to get that going, because it still is in infancy, but I can see it's getting strong, and it's going to be a major thing before 2030. So you have to keep on improving your data collection about your waste reduction, what you do about waste management, what happened to the water, how your employees do, employees' feedback, health and system, your occupational health reports, happiness index, your customers, how they do, the society around you, what's your input in the society. You have to collect all this data. And sector-specific ESG topics mainly focus on healthcare. Sector benchmarking, look at every other organization in the healthcare system and see where you stand from it. Stakeholder-specific factors, you have to communicate with the government, with the NGOs, with other social active organization, with your patients, with your workers, and get some ideas from them. Scoring methods, this is difficult because there is no single scoring method. This is why it's a time to collect data, but there is many of them in the market. None of them is officially accepted or seen at the gold standard. Okay, but it seems to be coming, most probably in 2023 is going to be quite obvious. And track your ESG performance. See your KPIs, how many you achieved, and how were you going. So it has to be quantified sometime. Till now it's hard because we don't have a way to quantify ESG. So there is ESG standard boards. You can see here a number of boards, Sustainability Accounting to International Integrated Reporting Council. All these are boards who can come for a fee and study everything. And I believe what they can do, anyone can do in the organization. Since they're given the task and they have the ability to sit down and analyze it, open-minded, they can come with it. But because they're official, people tend to go for them. And it's a growing business as well, not only for healthcare, for every care or every industry. There is global ESG standards, which is coming out from the United Nations as part of the Sustainable Development Goals, but you have to fish them out and put them together. And there is certification. There is something called B Crop certification, managed by B Lab. It's a private, non-for-profit entity, and I put the only one because they claim that they're the only non-for-profit or for-profit organization in the world that can certify your business. I believe that there are going to be more of them, but the most important thing that non-for-profit is part of your social responsibility. And mandatory disclosure. The government has to come with mandatory disclosure of information to the public. We come to sustainable development, which ESG is a measurement that goes for things that all go into sustainable development goals. We all have to be all over there by 2030. We're working hard for it, and especially in UAE, I can see UAE map in the middle there. We are taking it very seriously. Each one of the 17 goals, we are really, really taking it seriously. Measuring it, working for it, everything is done consciously or unconsciously. All the government or the private sector working for it, and we hope that the rest of the world have similar activities. So, yeah, the target is by 2030, okay, global mental mortality ratio is less than 70%, maternal mortality. So it's mainly for children, mothers, because it's affecting the maximum number of people in the world, in the underdeveloped world or developing world. This is a major issue, been chased for a long time. I think that they have more people dying from this than anything else. Preventable death of newborns and children, that's easy, from nutrition to healthcare to infectious diseases. End of epidemics and communicable diseases. We succeeded in containing COVID and almost abolishing it, and hope that you're going to go the same way like smallpox and plague. So we have to work on that, set up the system. Premature mortality and promote mental health. Mental health is very important, it's ignored everywhere. And I'm glad to see people here talking about mental health and how to manage it, and stress, work, related things. It became a highlighted thing, and it's no longer a social stigma. Substance abuse is going like crazy all over the world. Now there is a lot of movement to cap it. It's no longer a source of high income and risks. So we have to work on that together through education, through building up schooling and so on. Okay, RTA, injuries, death, has to be reduced. Ensure family planning, information, education. This comes to education. Achieve universal health coverage. That is what we're working for. And we work at individual healthcare organization that will look after everyone regardless of their insurance or their financial situation or their position. Yes, there is different in how the atmosphere is. We have 7-star hospitals, and we have 5 stars and 3 stars. That's the difference. Your room will look different. Your room could be like IKEA, which is good enough, and the other room looks like Versace. That's the only difference. But you have the same team looking after you, the same doctor, the same quality of care is given without holding back. And increase health financing. This is an issue here, so we have to tap into the new generation controlled financiers, mainly with our ESGs. As I said, they have the ethical question big in their head, like pension funds. Now, the pension funds moved away from any poor ESG organizations. Now, the United States government are trying to put a cap to that. They said, no, you cannot stop people because they don't have good ESG. But nobody listened. Said, okay, you can put the law, but I choose whom to finance or whom not to finance. So it became more into the hand of people and awareness. So capacity of all countries for early warning, risk reduction, and management of national and global health risks. We have to work at the level of our organization, work hard on that, do the best we can. Automatically, we will go involved from our ESG, the United Nations Development Sustainable Programs, and this way we become a cogwheel in a big holistic universal thing. So we can here, USDG, 3 aims, okay, prevention, care, and improvement, sustainable improvement. Contribute to ESG, you have to ask yourself that question, how can we do that as a healthcare sector? In-house, send the message, be part of the universe. Okay, and responsibility, ensure well-being of its workers. This is very important. Dr. Mustafa keep on mentioning it to me so many times, said to me, health worker, more productive and more efficient. Role of healthcare sector in supporting the UN SDGs, you have to ask yourself this question. You have to find the answer within your healthcare system and yourself. It's not an ethical dilemma, it's a principle that you have to stand with. It's our choice, our future, our planet, so look after each other. Thank you very much.
Fantastic. Thank you very much, Dr. Omar, for a very insightful presentation. I love it. I love the focus on the planet. I think that's where we're all going. You see that microphone in the middle of the room? Now's the opportunity to come on down and ask Dr. Omar some questions. Obviously, a local professional expert in the region with a lot of expertise and knowledge that he brings to the table. Would anyone like to be the first up and engage in front of the room? I think we might need a little shot of caffeine for everybody here this morning. I know you're looking far and wide. How did you get into this? What really motivated you to get into this part of the world and the service that you're doing?
I'll tell you something. It's a very strange thing, right? We were moving away from being a company to be a holding company, and then to be a publicly trading company. Okay, so we are no longer a privately owned entity. We are a public owned organization. And one of the main things that you have meetings again and again and again. I have 4 children, 3 boys and a girl. All of them are economics, extremely intelligent, took after their mom. And we sit down together and they talk the jargon. And I said, like, oh my God, I'm really out of date. So I keep on asking, please ask the young ones. The young ones are very full of wealth. So they start talking about it. And then I start to talk about it in the board meeting. And everybody says, You came with a new thing, and it was called Jugaad, fixing things. And it was a cornerstone talking to these young guys with a spot on their face coming from Ernst & Young and like Morgan, JB Morgan, asking us questions. So I came up and said, oh, Grandpa, you're really good. So I carried on. It's enjoyable. Yes.
Perfect. Good morning. I really appreciated your presentation today. Honestly, you sound like a minister of health, more than someone who's in the private practice.
Thank you.
So my question to you, I think in Abu Dhabi you have similar challenges and opportunities as we do in Oman, because we're sort of central between the East and the West. But with that comes challenges. As a physician, you know, there's different schools of thought, whether it comes to clinical medicine, different guidelines, also different approaches to healthcare. How do you navigate those different schools of thought? How, both in your day-to-day work as a CEO as well as a clinician, how do you navigate the differences, which are also opportunities, in your hospital?
Okay, thank you. And I believe that you are from Oman. We have an existence in Oman, most probably you know. For those who do not know Oman, for my point of view, okay, is one of the most advanced countries in health sector that's taking solid steps in the MENA region. Maybe Saudi Arabia is the biggest, Emirates comes next, right? But you know, if you see the future, I can see Oman coming very, very well. Solid ground, no changes. Every step they take, they don't need to look back. But the whole thing is, as you can see in Oman also, is the people of Oman are running the show. And I'm not like sectarian, but because they have a strong belief in what they do. And they have this ambition to see themselves high up there. So ambition drive is very important. And also clinicians are leading the system. So now it becomes a clinician-led service or care, because there are always a bridge between clinical team, management team. They meet in meetings, hi, goodbye, they carry on. They are not separating, they are not coming together, but two parallel lines going. How can you link between them? Because clinicians, sorry to say, there's a lot of clinicians here, they think that they're much more intelligent and clever than just listening to managers. Let them talk about accounts. You don't know what you're talking about, okay? And they have the superiority built on them from the society. I always tell my colleagues here, they said like, humbleness is my weakest point. So this is how it is. And then you go to clinicians, say like, oh, how can we manage these clinicians? They don't listen, they think they know, they don't know, and they don't care. All what they want, to come to the clinic, see their patient, get things going. That's all what they look for. Yes, it's our job to provide this for them, but there is a bigger policy, the bigger picture. And I believe now, for clinicians, the new generation have embedded management skill training as compulsory part of their education. And what we do in our organization, we have the same issue. We're pulling them, whether they like it or not, through the clinical governance way, to bring them in, to put them together, and push them. They like appreciation and money, clinicians. And managers like to be listened to and recognized as high up. So you have to play around with them. If I answered that question right, that's it? Good, thank you.
Perfect. We got time for two more. Thank you for standing patiently.
Very good morning, Dr. Omar Abdel. And this was an excellent presentation on ESG. How far have we reached as far as UN SDG goals for 2030 is concerned, considering that we are in a VUCA world, right? And with the corona that came 2 years back, do you think these goals are achievable?
Good question. For somebody, he might lose business over these ones. He's a plastic king, recycling. So if you don't lose plastic, I don't know. I'll find you a job with us. No, if you look at it, he asked a certain question that has got multiple facets. Corona, COVID-19. COVID-19 was very important for humanity. We do not always take the negativity. It's bad. We lost loved ones, friends, colleagues. We lived in horror Some people could not do a lot of things, but we have to come out with lessons. We learned that we have to be one unit in one planet. Doesn't matter, rich, poor, America, Nigeria, Sudan, China, you were hit by COVID. We all worked together. We all had the same vaccines. We all worked on the science. We all came together, and that was a sparking area to make us look at what people talk about. Sustainable Development Program. We have to work as a planet, not as individuals or countries or sectors. This is one. When you tell me, like, are they achievable? This is where the question is. What are we trying to achieve? Where social responsibility ends is endless. Every time we reach a point, like a KPI, a new one comes up. So the idea is always, it is not a destination, it's a journey. Keep that in mind. Thank you.
Hi, good morning. Joanna Atwani, Evercare Group. Thank you for this very enlightening and useful presentation. I have one questions. I mean, we all agree that ESG is very important, and I think many companies and healthy groups are doing their shares in order to demonstrate that really they are addressing environmental, social, while they're doing their own, or they deliver in their own mandate. However, you usually have investors with different indicator KPIs to measure ESG, or even to assess whether a company is addressing ESG matters in their work. As the CEO of a leading healthy group, how you overcome that? How you satisfy all your investors with the different requirements and the different assessment to measure your ESG?
Okay, good. I mean, one of the main things to establish this system, remember, don't use people coming out of the museum. Cut line, 40 years of age. Below that, they will lead. Above that, they will support. Done. We need young people to lead in this. Okay? They know better, they're clever, they were read, their ethical background is different because it came up from where we stand, and they developed it to the needs of the current situation. They will give you the answers usually. The youngest one, always ask him and they will give you the answers. Do not underestimate their powers. They try always to make you feel good that you know because you are the eldest. No, you have to be realistic. They're far ahead from education, from knowledge and things like that. The board plays a big role into the investors. You cannot just follow the investor's point. This is one. And till now, there is a diversity and disagreement on how you measure your ESG in a company. So make sure that you have one of the young people in the company in charge of your ESG goals, collect the data with the help of quality department, analyze it, and produce their own reports. So you have your own rating in the department or in the institute you work in. Always rate yourself. Give yourself an A star. But make sure that you earn this A star by your own ethical standards. Just don't make it up. And don't make ESG a tick box. Sooner or later, you will know that you are tick boxing, and you will lose your investors. When you start going there, the first meeting with the investors, bring these young people to the table and say, please, can you tell them about our ESG? These are the leads of ESG. These are the leads of tomorrow. This goes into what we call, in the corporate world, succession plans ready. Investors will look at this. He's got their succession plan ready. They are already having a mini board. Youngest is coming up. Investors will listen. And always, when you sit down, don't look at the old ones in the investing committee. Look at the young ones. They have to have young ones. They will understand the language of ESG. They will understand its importance, and they will put their money where it is.
Amazing. You're 100% right. Thank you, Dr. Omer, shedding the light, ESGs in so many ways, more than one. Incredible. I invite you to talk to him offline. He has a lot of information. Well done. Thank you. It's a pleasure to have you here.